Hi, my name is Kelly, and my interns are James, Nicole, and Diana. And today we'll be presenting about the anatomy and physiology in the heart of the human body. Next slide. Today we'll be going over introducing what is the anatomy and the physiology, then introduction to the cardiology and the pathology of the heart, and any of a career pathway and the Kahoot. Next slide. Next slide, please. What is the anatomy and physiology? Anatomy and physiology is the study of human body and structure and how it functions. Both the anatomy and physiology have different meanings to it, and both study the different organ systems and how they function in our body. The purpose of studying the anatomy and physiology is to understand the way the body works and to help maintain health and prevent diseases. Anatomy is focused on the structure of the body and the body's internal and external structures, including cells, tissues, organs, and how they are physically related, while physiology focuses on the function of the body. Next slide. Now, moving on to the branches of physiology. There are various types of branches and fields of physiology, both focus on different studies within the human body, but today we'll be discussing about these 5 branches of physiology. Cell physiology is the study of how cells function and interact with their environment, including how they respond to stimuli and maintain life. System physiology, the study of how biological system works and responds to changes in their environment using engineering tools and mathematical computational modeling, and how individual cells, components, and components of a system work together to respond. Clinical physiology. Clinical physiology is a branch of physiology particularly dealing with functional disturbance and disease and the integrated function of the human body in disease. Neurophysiology, the study of the nervous system functions, including the electrical and biochemical processes that occur with it. And lastly, exercise physiology, the study of how body responds to physical activity and how it adapts to exercise over time. Next slide, please. What's the human body? The human body is the study of all aspects of the human organism, including evolutions, genetics, anatomy, physiology, development, anthropology, and nutrition, among others. The human anatomy can be studied at different levels. Gross anatomy, the study of major body structures that can be seen without magnification. This is often done through dissections and observation. Regional anatomy, the study of the body structure by region with an emphasis on the relationships between the different structures in the region. Systemic anatomy is the study of the structures that make a body system or a group of structures that work together to perform a specific function. Microscopic anatomy is the branch of anatomy that relies on the use of microscopes to examine the smallest structures of the body, tissue, cells, and molecules. Now, moving on to the human body system, there are many parts of the human body system. One, the integumentary system, the body's largest organ system, forming a physical barrier between the body and the external environment. The skeletal system, made up of bones that give structures to the human body. The muscular system, a group of organs that allows the body to move, maintain posture, and circulate blood. The nervous system, a complex network of nerve cells that controls and coordinates the body's actions and sensory information. The respiratory system, a biological system that exchanges oxygen and carbon dioxide in the body. The lymphatic system is an organ system in vertebrates that is part of the immune system and complementary to the circulatory system. The digestive system, made of organs that are important for digesting food and liquids. The urinary system eliminates waste from the bodies, regulate blood volume and pressure, control levels of electrolytes, and metabolites, and regulates blood. The reproductive system, a collection of organs in both males and females that are responsible for producing sex cells, facilitating fertilization, and enabling the development of a fetus during pregnancy. The endocrine system, the network of glands that make hormones. And lastly, the cardiovascular system, which we'll be focused on today. The human body organs contain the brain, the lungs, the liver, the bladder, the kidney, the stomach, the intestine, and the heart, which we'll be talking more about in today's presentation. Next slide.
So, hi, my name's Diana. I'll be introducing you guys to cardiology. So, cardiology is a specialized field of medicine that focuses on the study, diagnostic, and treatment of the heart and cardiovascular diseases. This branch of medicine covers a wide range of heart-related conditions, from congenital heart defects, those that are present at birth, to acquired issues like coronary artery disease, heart failure, and arrhythmias. To diagnose these conditions, cardiologists use a variety of tests. Some common non-invasive diagnostic tests include electrocardiograms, ECGs, which record the electrical activity of the heart, echocardiograms, which use the ultrasound to create images of the heart, and stress tests, which measure how the heart performs under physical stress. These tests also allow cardiologists to assess heart function and identify any abnormalities. As you can see in the image of the heart here, the heart has multiple chambers and vessels that work together to pump blood through the body. Understanding the heart structure and function is the key in cardiology to ensure proper diagnostic and treatment. Next slide, please. So it's crucial in understanding how different factors like genetics, lifestyle, environmental influence that affect heart function. Since the heart is central to overall health, cardiology plays a vital role in helping us maintain a healthy body. Cardiology also emphasizes prevention and promoting heart health. This means that besides treating heart diseases, it's focused on finding ways to prevent them, such as through lifestyle modifications or preventive care strategies. Now, what does cardiology involve? This field is dynamic with ongoing research with innovative therapies and treatments. It includes invasive procedures like surgeries or interventions to treat or correct heart issues. Cardiology also explores new pharmacological agents to improve heart function and manage diseases. Next slide, please. So the cardiovascular system is a network of organs, primarily the heart and blood vessels, that play a crucial role in maintaining life. Its main function is to supply blood, oxygen, nutrients, and other essential substances to all the cells and organs throughout the body. Without this system, cells wouldn't get the oxygen or nutrients they need to function. Besides delivering nutrients, the cardiovascular system helps the body maintain homeostasis, a stable internal environment. It regulates body temperature and adjusts to the demands of physical activities, emotional stress, and changes in the environment. An important aspect of the system is waste removal. The cardiovascular system helps get rid of waste products from the body, including carbon dioxide produced during respiration, chemical byproducts from various organs, and waste from foods and drinks. By supporting these functions, the cardiovascular system plays a key role in keeping our bodies healthy and balanced. Next slide, please. So, a cardiologist is a doctor who specializes in diagnosis, treating, and preventing disease related to the heart and blood vessels. They can help treat a wide range of cardiovascular problems, from high blood pressure and cholesterol issues to heart rhythm disorders and heart failure. Cardiologists also focus on helping patients prevent heart disease through lifestyle recommendations and preventive care. Cardiologists often specializes. For instance, some focuses on heart rhythm disorders, while others specialize in managing heart failure or congenital heart problems that people are born with. So, what can we do to keep our hearts healthy and prevent heart disease? Cardiologists recommend a few key lifestyle habits: maintaining a healthy weight, eating a balanced diet rich in nutrients and low in processed foods, regular exercise to keep the heart strong and the blood vessels flexible, and avoiding smoking while limiting alcohol consumption. By these healthy habits, we can greatly reduce our risk of heart disease and improve overall cardiovascular health. Next.
Okay, so now we're going to talk about some common diseases of the heart. The pathology of the heart. Pathology is the study of diseases, and in this case, we're going to be talking about common diseases that are associated with the heart. Now, the first one is you guys are probably familiar with it. It's called a myocardial infarction, also known as a heart attack. So usually the causes of heart attacks are because there's blockages in an artery, also like specifically the coronary artery. As you can see on the diagram on the right over here, the coronary arteries are the ones that are situated on the heart. And these blockages are caused by buildup of fatty deposits or plaque in those arteries. And as you can see in this diagram right here, you can see all the plaque buildup that prevents the blood from properly circulating. And because of that, your organs, your limbs are getting an inadequate supply of blood, causing it to have like a lack of function. And there's actually a term for this. It's called atherosclerosis, which is just the blockages of the arteries. Although it doesn't necessarily have to be a buildup of plaque that causes these blockages. It could also be like a spasm of the arteries that causes the arteries to shrink and reduce blood flow. So these symptoms of a heart attack include shortness of breath, chest pain, nausea, or vomiting. The chest pain is due to the oxygen-deprived heart muscles. If somebody is ever experiencing these symptoms, it can be helped with aspirin, which helps thins out the blood, or nitroglycerin, which helps open up the arteries. If you were to take it to a cardiologist to get it treated, they can treat it with a procedure called coronary angioplasty. And what that does is that they insert a catheter, which is a tube, into your arteries to try and open it up with some sort of balloon. These plaque buildups occur as you age. So usually people with the age group 65 and older are more prone to heart attacks. And it doesn't necessarily have to be due to age. It could also be because like due to eating high fat foods or having a lack of physical activity. And this proves that studies shows that obese individuals are more prone to heart attacks. And then next is cardiac arrest. So cardiac arrest is very similar to heart attacks. People may get them mixed up, but heart attacks are more due to a circulatory problem where there are blockages in the pathways where blood is supposed to circulate. But cardiac arrest is more geared towards the heart, where there's some sort of problem with the function of the heart. So it could be because that the heart suddenly stops beating or it has irregular beating. And this can be caused by ventricular fibrillation, which is when the heart chambers sort of quiver instead of pumping blood normally. And some symptoms of this include loss of consciousness, lack of pulse, and no breathing. So you can tell that these symptoms of cardiac arrest is much more severe than heart attacks, as it can bring death more rapidly. So to treat this, when somebody has sudden cardiac arrest, they may collapse. And what you want to do is you would want to check for a pulse. And if they don't have any pulse, you can immediately start doing CPR or using an AED, which gives a shock to the heart and kind of like jump starts it. Next slide, please. And then next we have a stroke. So some of you may know that a stroke occurs when half of the body becomes paralyzed. It's unable to function. So this is due to the blood flow to part of the brain having an inadequate supply of blood. So this usually happens when the arteries leading up to the brain sort of ruptures or there's a blockage, so blood isn't able to get to that part of the brain. So when there isn't enough blood to the brain, it causes some brain cells to die, and this kind of affects the function of that brain. And since like some parts of your brain controls like the motor functions of your body, like how it moves and stuff, if there isn't enough blood in the brain, then it's not able to send signals to those parts of your bodies. And to memorize these symptoms, you can use the FAST acronym. So F is for face, where you can ask a person to smile, and if their smile is droopy, that's a sign that they could have a stroke. Next is A for arm. You could try to ask a person to raise both of their arms, and if they're unable to raise like their right or their left, then that means that half of their one of their sides of their bodies are unable to move. And then next is speech. You can ask a person to try talking, but if they have slurred speech or they struggle to talk, then that's also another sign of a stroke. And finally, time. That's not really a symptom, but it's a good reminder to make sure that you call 911 or EMS in the case of a stroke, because you would want to bring them to a hospital ASAP to reduce disability when recovering. And then finally, we have pericarditis. Not much people know about this, but it's the inflammation of the pericardium. So the pericardium, as you can see in this diagram on the right, it's it's a sac that your heart lies in, and pericarditis is basically the inflammation of that. So pericarditis can cause swelling, and it can also cause scar tissue. And as you may know, scar tissue is hard and stiff. So when scar tissue forms on your heart, it limits like the mobility and the flexibility for it to properly pump blood. You can experience sharp chest pain, shortness of breath, fever, and dizziness. The treatment can the treatment does depend on the severity of the disease, but for more mild conditions, you can take aspirin or ibuprofen to reduce inflammation. Next slide, please.
Now we will talk about other careers that specialize in physiology and anatomy. For example, pharmacologists. Pharmacologists develop and study the effects of new drugs to ensure both effectiveness and safety. They are extremely valuable to the medical field and perform a crucial part in the safety of patients. Now, if you're interested in becoming a pharmacologist, you must first earn a bachelor's degree, which takes roughly 4 years, then choose to work an internship and begin choosing a specialty. Because drugs are used in so many different areas of medicine and for many different reasons, most pharmacologists choose to specialize in a narrower area where they can gain more in-depth knowledge. Afterward, you would obtain your master's degree, which takes 1 to 3 years, and lastly, obtain your PhD. Now, some skills that you should have that if you're interested include your excellent knowledge of chemistry and biology, expert in lab procedures, good communication, and attention to detail, organizational skills, and problem solving. The salary range for pharmacologists is roughly around $130,000 to $160,000, although this could vary from position and experience. Next slide. Biomedical researchers. Biomedical researchers study biological processes and diseases with the goal of developing treatments and cures. Biomedical researchers are the main supply for ideas that can lead to potential therapies that will be tested in clinical studies. They design studies to test and develop new treatment plans, analyze medical data to investigate pathogens and chronic diseases. The pathway to becoming a biomedical researcher include first obtaining your bachelor's degree, which again takes 4 years. You could gain early work and research experience, which is optional, and your time may vary on that. Then you can also earn your master's degree, which is also optional and takes 1 to 3 years. And lastly, earn your PhD, which takes 4 to 7 years. The skills required to becoming a biomedical researcher are communication skills, critical thinking and decision-making skills, data analysis, and observation skills. The median salary for a biomedical researcher is around $100,000 in the US. Next slide. Next, physical therapists. Their description is to help injured or ill people improve movement and manage pain. They are often an important part of preventive care, rehabilitation, and treatment for patients with chronic conditions, illnesses, or injuries. The pathway to becoming a physical therapist are obtaining your bachelor's degree again, which takes 4 years, earn a doctor of physical therapy degree, or DPT, which takes 3 years, then pass your national physical therapy exam, also short for NPTE, then lastly obtain your state license. Skills to becoming a good physical therapist include communication, compassion, time management, and resourcefulness. The median salary is around $900,000, but the salary range is $94,000 to $111,000. Next slide. Neurophysiologists. Neurophysiologists assess and diagnose conditions that affect the function of your body's nervous system. They mainly do this by performing and analyzing a variety of tests that record your nervous system's electrical activity. Unlike neurologists, who are medical doctors who have training in all aspects of your nervous system, including its general anatomy and function, and the conditions that affect it, a neurophysiologist is a neurologist who has specialized knowledge specifically on the function of your nervous system. They perform tests and interpret the results to do so. The pathway to becoming a neurophysiologist includes 4 years of pre-medical education at a college or university, which gets you your bachelor's degree, 4 years of med school, which gets you your doctorate of medicine. You can get 1 year of internship in general internal medicine and up to 4 years of residency, which depends on your program in a neurology program. Now, some people may also choose to do a fellowship program after residency to subspecialize in a specific area of neurophysiology. These fellowships can include and focus on epilepsy, neuromuscular diseases, sleep disorders, and more. Now, some good skills to have are communication skills. Neurophysiologists typically speak to many different people during their line of work, including other healthcare professionals, leading experts in the field, and patients. They may find themselves communicating with other doctors to discuss a treatment plan, adverse symptoms, or a specific patient's condition. Organization. Neurophysiologists typically work on many different patients and have to know each other's patient's situation and treatment. Neurophysiologists benefit from having a strong memory and organizational skills. To help them stay organized, they need to keep notes recording each patient's condition and treatment plans. Keeping their notes clear and organized is a very helpful way for effective patient management. Knowledge. This is kind of obvious, but neurophysiologists typically have to have an excellent knowledge of science, particularly in biology. Lastly, research. Neurophysiologists may spend a considerable portion of their career researching diseases and treatment methods. While neurophysiologists may not decide on new treatments themselves, they may research different treatments authorized by their employer. They often read journals and books about neurophysiology and stay informed about the latest developments in the field. The salary range for a neurophysiologist is around $250,000 to $350,000. Next slide. And the following 2 slides are our sources and resources that we use. Thank you.
Thank you. If you guys have any questions, you guys can type them down in the chat.
Yeah, so this group did a great job of first giving an overview of kind of all the different systems and how they kind of work together, and then diving deeper into cardiology and the heart and kind of the different diseases. So yeah, feel free to drop any questions in the chat. Ethan, I'm not sure what you mean by which is easy. Do you mean like which specialty, which pathway, which yeah. Oh, okay. But I feel like in general, there's no one pathway that's easier than others. What's really important in choosing is like what you're passionate about, because that keeps you going in every um specialty and every pathway, whether it's in medicine or any other field, there will be hardships that you encounter. Um, and staying passionate about the field that you're pursuing is what keeps you going. Yeah, wait, when we move on to the Kahoot, I'll change the settings to let you see the question. Okay, what is the difference between internal and not internal? Is there a specific slide that you're referring to for that? And then how long to become a cardiologist? Um, and then matching at a teaching school. So cardiology, oh, okay, I see what people are referring to. So basically you go to medical school, then you match into residency, right? So for cardiology, first you would do 3 years of internal medicine. And that's like what so internal medicine is like when you're over 18 and you see a doctor, that person can be your internal medicine um doctor. So it's like not pediatrics, but more broad. And then after your internal medicine residency, and after that, you do 3 years of a cardiology fellowship, which is more specialized. And so you're focusing more on the heart. Does that make sense? Yeah. So internal medicine is mostly like focused on adult medicine. Um, and so it's more broad. So they can diagnose diseases, um, help with like chronic conditions, long-term illnesses, and then they have the ability to also refer their patients to specialists if needed. Internal medicine is 3 years, but a lot of people uh, pursue a specialty in internal medicine, and after that they pursue a more specialized field within the medical field. So they'll do like oncology, cardiology, um, and focus on different aspects of that. Yeah. Um, okay. Yeah, feel free to keep the questions coming. But I think our group of interns made a little Kahoot for us to kind of review the concepts. So I'll go over that now. And then someone mentioned changing the settings. Oops. Okay, wait, let me see. Changing the settings so that we can see the questions.
I can share my screen for this one.
Oh, okay, perfect.
Oh, yeah.
But yeah, I think in general, like cardiology is such an interesting field because it's not just like conditions that affect the function and structure of the heart based on like anatomy and like plaques building up over time, but there are also other conditions that can affect your susceptibility and vulnerability to heart disease. So like if somebody um has cancer, for instance, and they receive chemotherapy treatment, there are agents in those treatments that can affect heart health. So it's a very dynamic field and it's related to a lot of different illnesses. And it kind of ties back to what our interns were talking about how all these systems are ultimately working together. And they're not working like they're listed as separate organs, but um, overall they're working together and they need each other to function and keep the body functioning.
It won't let me share my screen. Wait, do you see it? Do you see the screen?
Wait, it's okay, I can share.
Okay.
Okay, what was the setting that people were talking about? Sorry. Okay, wait, this is kind of handy. Thank you, Trisha. Sorry, I'm just distracted. Okay. Okay. Yeah, so the game pin is 588038. Um, and just yeah, feel free to join. Right. Um, I'm just gonna start like here, and then you guys can people can continue to join the code is in the chat and just kahoot.it and then you enter the code there. Okay.
What is physiology? So the first question is, what is physiology? Yeah, so physiology is a study of the function of the body and how it works together, like how it functions. True or false? There are 11 organs in total in the body system.
Yeah, this is kind of tricky. I don't think you'll be like expected to remember this in even in college. But yeah, there are 11 organs in the body system that we went over.
What is the acronym for when you have a stroke? Yes, so the acronym for when you have a stroke is face, arm, speech, and time. During a heart attack, which artery is usually restricted? Yes, so the coronary arteries is usually restricted due to the buildup of plaque in the body.
Yeah, and we went over the carotid artery last week, but that's a little bit different than the coronary artery, just to clarify that for people who chose the carotid artery. Okay.
What is the anatomy? Yes, so the anatomy is the structure of the body that includes the cells, tissues, and organs. What are the skills required to become a neurophysiologist? Yeah, so like the skills required are communication, organization, scientific knowledge, and research skills, but other skills are great too. There are only 5 branches and fields within physiology. Yeah, so fast. There are many different like various type of branches and fields within physiology. What does the pericarditis affect? And so the pericarditis affect the pericardium. Yeah. Which one of these is a diagnostic test in cardiology? Yeah, so the one of the diagnostic tests in cardiology is the ECGs, the electrocardiograms, and cardiograms. True, false. Cardiology is the study of the heart. Yes, so that's true. What is the salary of a pharmacologist? And so the salary ranges between 120,000 to 180,000. True or false? The cardiovascular system helps get rid of carbon dioxide. Yes, the cardiovascular helps get rid of carbon dioxide in the body. This can include like other chemicals in your body and waste from things you eat and drink. True or false? The cause of cardiac arrest is due to plaque buildup in your coronary arteries. Yeah, so this is false because the um cardiac arrest occur when the heart stops breathing or any regular breathing.
Yeah, wait, I want to go over the last question on the Kahoot. There are some questions about that. So basically the cardiovascular system pumps around the blood, and that interacts with the pulmonary system and um kind of digestive system and get rid of like nutrients. So everything travels through the blood, and that's the point of the last question. Hope that clarifies anything.
What is not a good way to maintain your cardiovascular system? Yeah, so smoking is not a good way to maintain your cardiovascular as it can damage your heart and like plaque buildup and inflammation in your heart. How many years does it take to become a medical researcher, a biomedical researcher? Yeah, so it takes around 8 to 15 years in total to become a biomedical researcher, with 4 years in earning a bachelor degree and around 4 to 7 years in to earn your PhD. What does physical therapist do? Yeah, so physical therapists help injured ill people, improving movement and managing the pain. Last question, was this presentation helpful or did you learn anything interesting or new? Yes, I'm glad that this presentation gives you like a knowledge in like more on the cardiovascular, and you learn something new from it. Good job, Xin, Jeremy, and Raghab. I'm sorry, I don't know how to say the name, but good job.
Yeah, thank you everyone for joining, for listening to the presentation and playing the Kahoot. Sorry I went over a little bit. But yeah, feel free to drop any questions in the chat. If not, you guys are free to go and have a great weekend.